Hello, I'm Lauren and I'm going to be your occupational therapist for today. Today's session is going to be an asynchronous telehealth video that's designed for adults living with chronic obstructive pulmonary disease, also known as COPD. This video can be paused at any time or replayed. I am going to go through pretty quickly without pausing, so just feel free to pause or rewind at any time and move at a pace that feels comfortable for you. To begin today, I wanted to discuss a little bit about COPD and what it is. It is a long-term lung condition that makes it harder for the patient to breathe. It is the combination actually of chronic bronchitis and emphysema. The two conditions together make COPD. With emphysema, the walls of the alveoli are destroyed, which cause the lungs to lose their elasticity and air to trap in the lungs, or just overall reduce the ability for lung movement when the patient inhales and exhales. And with chronic bronchitis, there is an excessive amount of sputum, which is just kind of a mucus-like substance, excessive mucus sputum production, and a cough that lasts at least 3 months and occur 2 years in a row. So people with COPD often feel shortness of breath, or when they're doing everyday activities like walking, cleaning, getting themselves dressed, they feel like they just cannot catch their breath and it's hard for their lungs to do the job that they were designed to do. This is happening overall because the airflow in and out of the lungs is limited and trapped and not to functional ability. So over time, this can cause a lot of fatigue, feeling sleepy a lot, feeling tired, low endurance, and sometimes anxiety related to breathing. Common challenges aside from those that people with COPD may experience are just getting tired quickly, feeling out of breath during everyday simple tasks like cleaning or brushing your teeth, slower movement during their activities because of this fatigue, difficulty keeping up with their management in their household or their work, and just generally avoiding activities due to fear of losing their breath. These challenges can make everyday activities feel very overwhelming. So today I want to just kind of discuss how we can deal with those symptoms and provide an intervention for the viewer as well that can be done at home. So today we're going to focus on an activity tolerance and breathing control. This will hopefully improve the skills that can be used to make everyday activities easier, safer, and most importantly, less tiring for the people that have COPD. The common household items that you'll need for this are a sturdy, safe chair to sit in, so that you can have your feet flat on the ground and sit upright, and one lightweight object. It could be a towel, a water bottle. I have both here. You could really use either one. A small book, anything that's less than 2-3 pounds, and a clear space where you can sit comfortably with lots of space around you. And the ideal situation for this intervention is to combine gentle movement with controlled breathing, which is important for managing shortness of breath so that we can practice those ways to understand how to deal with it and how your body may react to when you are feeling shortness of breath in higher paced, quicker paced situations. So for this intervention, the items you'll need is a sturdy chair and a sturdy surface with space around for movement, a lightweight object. I'm using a towel. You could also use a water bottle, a small book, an iPad, anything that's lightweight, I would say less than 2 to 3 pounds, and a clear space, like I said, where you can move comfortably. For this intervention, it is going to be a seated functional reach with pursed lip breathing. A way I like to remember pursed lip breathing is smell the roses, blow out the candle like so. In through your nose, out through your mouth with pursed lips. And this activity is going to combine gentle movement with controlled breathing, which is important for managing shortness of breath when we have more rapid or quicker paced activities. So first we're going to sit upright in our chair with both of our feet flat on the ground, hold the lightweight object with both hands, and take a slow, deep breath through our nose, smelling the roses here. And slowly reach forward with your arms, moving the object out. And breathe out with pursed lips, blowing out the candle. Bring your arms back and rest. So all together it would look like this. You can repeat this 5 to 10 times, taking breaks as needed The movements can be changed as well, and you can move slowly and stop if you ever feel dizzy or shortness of breath or any anxiety, any discomfort with this activity at all. Definitely pause, take a breath, or just stop the activity in general. This intervention will help you practice breathing and movement together. It also helps knowing when to breathe in and out. For example, if you were doing a push-up, you usually breathe out during the hard part. So you would and help move your muscles that way. So it's similar to this motion. Breathing in and preparing, and when we're doing the motion, breathing out. So this will help improve skills like getting dressed in the morning, reaching into cabinets, carrying things around the house, bringing in groceries, folding laundry, preparing meals, cooking, completing general household tasks like cleaning, wiping down the counter, vacuuming. All of these hopefully can be completed with less fatigue and less shortness of breath, because by practicing this exercise, you're training your body to handle everyday activities more comfortably, learning how to breathe while pairing it with movement as well. And this activity could be graded up or down, meaning it could be made harder or easier depending on where you feel like you're at, where your comfort levels are. For example, a way to grade up or make the activity harder would be to increase the repetitions or use a slightly heavier household item. You could use 3-pound weights, or you could use like a water bottle, for instance, is a little heavier and a little bit harder to grasp as well. So you could breathe in. With the water bottle, you're engaging your muscles a little bit more, and you're gonna feel a little bit more shortness of breath as it is a heavier object. And ways to grade it down, make the activity easier, could include reducing the number of repetitions that you do and performing only the breathing portion without the arm movement, just really practicing in through the nose, out through the mouth, without any movement. You could also use a guided tool like a box breathing, in for 4, hold for 4, out for 4, to help you really get that rhythm of breathing down and just kind of exercising your lungs in a way. It's important to always choose the level that feels safe and comfortable for you, because overall today we want to make sure that we are practicing our movement and our breathing at the same time to overall lessen the symptoms of fatigue, shortness of breath that often come with COPD. Thank you for participating in today's telehealth asynchronous session for adults with COPD. I hope this short and quick activity can help you pair movement with breathing techniques to really manage in through the nose, out through the mouth, expanding our lungs fully, and just getting in those deep breaths that we need for adults that are experiencing COPD. Just review the provided pamphlet that I have. I have some helpful community resources in there, as well as a little bit more information on what COPD is. I mentioned the American Lung Association that has tons and tons of information on COPD, other exercises that could help with the condition, other symptoms that could occur, medications, and lots of other possible things that could help. And review the helpful community resources, like I mentioned, that can support daily life and overall function to allow you to participate in occupations that are meaningful for you. Thank you.